good afternoon. So my name is Dr. Spencer, and I am a proud UWI graduate, class of 2009. And it is such a privilege to be able to give this talk on sleep and its effects on technology. When I was originally approached to give this talk, I was so excited. I was like, I'm coming back to Jamaica. Yeah, man, I'm ready for this. And then I was told, oh, it's going to be video conferencing. And I was like, oh my goodness, all of my dreams of Hell's Fish and Scotchie's jerk pork just went through the window. But nonetheless, I'm still very thrilled and happy to be able to give this lecture. So we can go right ahead. So I have no disclosures. Next slide. So the objectives for this presentation would be to discuss the use of technology in the bedroom, the demographic most affected, and the types of devices used. We're going to describe briefly how technology affects sleep quality and its association with depression, insomnia, and cardiovascular disease. Because technology use leads to sleep deprivation, I wanted to talk briefly about sleep deprivation and drowsy driving. And to circumvent all the negative effects of technology use in the bedroom, we're going to talk about good sleep hygiene practices, and we're going to end with the new developments going forward in sleep medicine. Next slide. So computers came into the home in the early 1980s. And at that point in time, there was one computer for the entire family. But now, almost 1 in 10 Americans own a personal computer. And 7 out of 10 persons have home internet. In 2011, there were 6 billion cell phones in the world, enough for 87% of the world's population. Next slide. So this is an article that was published in the Journal of Clinical Sleep Medicine, and it addressed sleep and technology use in Americans, and it was based on a poll done in 2011. Next slide. 90% of Americans use some form of technological device in the bedroom in the hours prior to sleep. The use of a television was most common, 60% of the time, and 39% of the time they were using their cell phones. And as many of you can relate to, especially with the advent of Netflix, everybody is catching up on their favorite show right before they go to bed. So of the 39% of the sample who used their cell phone, 72% were adolescents and 67% were young adults. Females were more likely than males to use their cell phone prior to bed, and the amount of media use in the bedroom in the hour prior to bed was related to difficulty falling asleep. And the study actually showed that the more devices that they used prior to going to bed made it even more difficult for them to fall asleep. Now, the devices that were most responsible for the difficulty falling asleep were the interactive devices or the stimulating devices, such as cell phones or video consoles, or even using your laptop to check work emails prior to bed. What we call the passive devices, such as watching television, was less likely to cause difficulty falling asleep. Now, those who did take their cell phone to bed, 57% of them reported leaving the ringer on so that they would not miss any notifications. And the effects of all of this leads to middle of the night awakenings, or what we call maintenance insomnia. Next slide. So this table was taken from the Pew Research Center, and it was basically a tracking survey that was done in 2010, and it details the population, the group of people who generally tend to sleep with their cell phone. So looking at the slide, you can see that men and women basically use their cell phone, sleep with their cell phone about the same amount, but it was the age group between 18 to 29 where 90% of them plus actually slept with their cell phone. And you could see that there was no real difference between education level, but people who are parents, and I guess some of you are, you can understand that you would want to keep your cell phone close to you, especially if you have like a high school kid or a college kid, you want to make sure that you're awake for any emergencies. Next slide. So in addition to sleeping with their cell phone, people would actually check their cell phones at night, regardless of whether or not it went off with a notification. So that is what this slide shows. So 81% of persons between the age group of 18 to 24 would actually wake up at night to check their cell phone to see if they missed any notifications. You know, they need to know what Shensia and Kim Kardashian are doing at all hours of the night. Next slide. So this table was taken from the British Medical Journal, and it was based on a large population study that was done on adolescents looking at the use of technology and their sleep. And just to break things down for you a little bit, SOL means sleep onset latency. And what that essentially means is how long does it take you to fall asleep once your head hits the pillow? And normally for adults, 15 minutes. Taking 15 minutes to fall asleep is considered normal. And this study showed that if you had a sleep onset latency of greater than 60 minutes, it was commonly seen in persons who use their laptop before bedtime, their cell phone, and their MP3 player. Also, to the far right of the table, you see that the sleep deficit, it was associated rather with a sleep deficit of greater than 2 hours in the majority of cases in persons who use these devices an hour prior to their bedtime. Next slide. So this graph was also taken from the British Medical Journal, the article that I just previously described. And basically the graph is showing you the relationship between sleep duration and hours of screen use. And on the side, they talk about the different devices used. And you can see that the longer that they use these devices in total, the less sleep that they got. And this was of a group of adolescents. Next slide. So the question is, if you're sleep deprived, how is it affecting your life? And this table is showing that of the 94% of people who reported getting insufficient sleep, the majority of them reported that it significantly affected a certain aspect of their life, whether it be their mood, their ability to function at school or at work, and even in some cases, their intimate relationships with their partners. And of the 37% who drove, some of them reported that they drove drowsy within the last month. Next slide. So in terms of this, screen time and insomnia and depression in teens is an area that is getting a lot of attention lately. And as you may have noticed with the previous slides, the teenagers and young adults are the ones who are most likely to go to bed with their cell phone and have the greatest effects of technology on their sleep. So a study done in Japan of 295 high school students showed that if they used their mobile phones for more than 5 hours, it was associated with insomnia. And students who spent more than 120 minutes or more on social media were more likely to exhibit signs and symptoms of depression. Other studies have shown that social media use of more than 2 hours is associated with poor self-esteem, psychological distress, and suicidal ideation. And people with insomnia are 10 times more likely to have depression and 17 times as likely to have anxiety as compared to those who get a normal amount of sleep. Next slide. So what are the mechanisms by which technology affects sleep? So there are two primary mechanisms that we're going to talk about. And the first one is the effect of the technology itself on the sympathetic system. So your sympathetic nervous system is the system that is activated in the fight or flight response. And in order for you to fall asleep, this system needs to be quietened. Now, using technology, simulation technology like your cell phone or video games prior to going to bed, it actually stimulates the sympathetic nervous system and makes it difficult for you to fall asleep because you become hyper-aroused. Secondly, blue light. So I'm sure everybody has heard about this. So blue light is emitted from every device that we use. So cell phones, your PC, everything. And blue light is the shortest wavelength of light, and it is most effective on the retina. So when the blue light hits our eye, it affects our brain and tells our brain to decrease the release of melatonin. And melatonin is a hormone that puts you to sleep, right? So by using blue light, we decrease the release of melatonin from the brain and therefore delay our ability to fall asleep. Other things that would, mechanisms by which our sleep is affected is that just by having our cell phone next to us in the bed, each notification causes us to wake up And by extension, it fragments our sleep and results ultimately in sleep deprivation. And studies have shown that even when we sleep with our cell phone on silent, the electromagnetic waves that are emitted from the cell phone can affect the quality of our sleep. Next slide. So, what are the effects of sleep deprivation? So, before we can talk about the effects of sleep deprivation, we need to realize that depending on your age, you have different sleep requirements. So the babies tend to need 14 to 17 hours of sleep on average in a 24-hour period. And as we get older, we require smaller amounts of sleep. By the time you get to 65, you would require about 7 to 8 hours of sleep would be sufficient for you. So next slide. So presently, sleep loss is a major condition, especially in the Western world. And on average, we're sleeping 1.5 hours less than we did a century ago. And sleeping less is often associated with being very productive. And a lot of CEOs sleep on average 4 to 5 hours a night. And of note, I don't know how many of you use the Huffington Post on your devices, but the CEO of that product actually collapsed from sleep exhaustion recently and broke her face. She literally fell forward at her table after getting less than 4 hours of sleep over a prolonged period of time. And now she is a big supporter of proper sleep hygiene and gets at least 8 hours of sleep each night. So next slide, let's talk about sleep deprivation and the neuroendocrine or immune system. So when we're awake, toxins are produced by the neurons in our brain. And when we sleep, these toxins are removed or more efficiently removed from our brain. And when we're chronically sleep deprived, it means that these toxins accumulate and can lead to neurocognitive dysfunction, such as Alzheimer's, dementias, and other forms of memory impairment. And this is based on a study done at the University of Rochester. Also, while we're asleep, our body produces cytokines, and these cytokines are released by inflammatory cells and our cells that fight infection. And so when we're chronically sleeping, we have a decrease your Okay, hello. Sorry about that. We had some internet connection problems, but I'm back. Okay, so we're going to talk about the effects of sleep deprivation. But before we can talk about that, we need to establish what is considered sufficient sleep. So this is a table taken from the Sleep Foundation, and it details sleep duration recommendations. And as you would notice, the older you get is the less sleep you require. So newborn babies, anywhere from 0 to 3 months, require 14 to 17 hours of sleep. And as you get progressively older, by the time you get to 65 plus, anywhere between 5 to 6 or even 7 hours of sleep is considered sufficient. Next slide. So sleep loss is common, especially in the Western countries. And they tend to be sleeping, or we are now sleeping 1.5 hours less than we did a century ago. CEOs and other professionals sometimes average 4 to 5 hours of sleep, as it's thought that the less sleep you have is the more productive you're going to be. But this is not actually true. I don't know how many of you are familiar with Huffington Post on your iPad or on your personal computer, but the CEO of Huffington Post, Ariana Huffington, actually collapsed at her desk from sleep exhaustion and now is a strong supporter of proper sleep hygiene and sleeps at least 8 hours a night. Next slide. So now we're going to talk about sleep deprivation and its effect on the neurocognitive and immune system. So when we're awake, toxins produced by the neurons in our brain are accumulate, and they are moved most efficiently when we sleep. And over a period of time, if you're chronically sleep deprived, there is accumulation of these toxins, and it can affect your cognitive function. So it can lead to memory impairments over a longer period of time. It can lead to dementia, And this was based on a study done by the University of Rochester. Also, while you're asleep, your body produces cytokines, which are substances that fight infection. And when you're chronically sleep deprived, your body produces fewer of these molecules. And over time, it can affect your immune system ability to fight off infection, and it can reduce your response when you receive vaccines. Next slide. So sleep deprivation and this relationship between obesity and diabetes. Now, when we are sleep deprived, there is an increase in the sympathetic nervous system. And an increase in the sympathetic nervous system can negatively affect the pancreas and decrease insulin secretion, especially after meals. Now, when we're sleep deprived, it's also seen as a form of stress. And when we're stressed, we have increased release, our body releases cortisol. And this is to help us to stay awake. But cortisol can antagonize the effect of insulin. And so over time, it leads to an elevated blood glucose level and increases your risk of developing type 2 diabetes. And these effects between insulin and cortisol are seen if you get more than 4 to 6 hours of sleep per night. Another thing would be that when you're sleep deprived, there's an abnormal level of the hormones that are responsible for you to feel full after you eat, and the ones that are responsible for increasing your appetite. So what it leads to is you feeling hungry all the time, and you crave these sugary foods that are high in fats and carbohydrates. And this leads to overeating and obesity. And we all know that obesity is a risk factor for developing type 2 diabetes. Next slide. So in terms of sleep deprivation and cardiovascular disease, so studies have shown that a sleep duration of 5 hours or less per night is associated with an increased risk of hypertension in persons aged 32 to 59 years. And short sleep, as well as long sleep, usually for the study was considered more than 9 hours, is also associated with an increased risk of heart attacks. And it is thought to be due to the increased sympathetic nervous activity, as we mentioned before, which would lead to an increase in heart rate, it would lead to vasoconstriction and salt retention. Next slide. So to bring this home to Jamaica, this table is showing you the risk factors that drive the most death and disability combined. And it's comparing 2007 to 2017. And you can see the number 1 and the number 2 cause of death and disability was a high fasting plasma glucose and a high body mass index. And as I just described before, sleep deprivation, chronic sleep deprivation, can lead to both of these things. Next slide. So this is something that I found is very close to my heart, because as a medical student and working in the hospital doing 24-hour call, there was many times that I drove home sleep deprived and drowsy, right? So in America, 60% of Americans have driven drowsy, and 1/3 of the people have fallen asleep while driving. According to the CDC, an estimated 1 in 25 adult drivers 18 years and older have reported falling asleep while driving. The National Highway Traffic Safety Administration estimates that drowsy driving was responsible for 72,000 crashes, 44,000 injuries, and 800 deaths in 2013. Next slide. And bringing this home again to Jamaica, there was an article published in the Gleaner a few years ago, which showed that over the past 3 decades, the Road Safety Unit has recorded 744 crashes caused as a result of drowsiness while driving. Next slide. So sleepiness can impair driving performance as much or more so than alcohol. And this is based on a study done by Dawson in 1997 and Powell in 2001. The study showed that being awake for 18 hours continuously can make you drive like you have a blood alcohol level of 0.5. And just to reference, the legal blood alcohol content in Jamaica is 0.08. The study also showed that no sleep for 24 hours is equivalent to a blood alcohol level of 0.1. Next slide. The way forward. Next slide. So in addition to chronic sleep deprivation being a public health concern, there needs to be new regulations and recommendations to adjust this, or to address this rather. Some of the things that we can do on our own are listed here. So the number one thing we can do would be to avoid using electronic devices 30 to 60 minutes prior to bedtime. Some sources actually recommend removing devices from the bedroom altogether. If you have to use your personal computer at night for work or for school, it's recommended that you use tinted glasses while doing so. And you can, a lot of the newer devices, especially cell phones for sure, I know for sure Samsung has this capability. You can actually use a blue light filter, and so as to not have the negative effects of using the technology at night. It's also recommended to have a fixed bedtime and wake up time 7 days for the week. It's recommended that you use your bedroom for sleep only, and it shouldn't be used as a place for entertainment or watching TV or that sort of thing. And you need to ensure that your environment where you sleep is cool, dark, and quiet. It's also recommended that you develop a bedtime routine, kind of like what you do for children, like for babies. You do stuff so that you get them ready for bed. It's recommended that you continue to do the same thing for yourself as well, so that your body knows that if at 9 p.m. I take a cool shower, it's time for me to start winding down so that I can fall asleep. Next slide. Exercising regularly can actually improve sleep quality. It is recommended, however, that you exercise either in the morning or during the day, because exercising 1 to 2 hours before your bedtime can actually be stimulating and make it difficult for you to fall asleep. It's recommended that you avoid stimulating substances such as caffeine and nicotine close to bedtime. Alcohol as well should be avoided prior to bedtime. A lot of people use alcohol, like a glass of wine or so, to relax in the evenings. But even though it can be relaxing and sedating, once the alcohol is metabolized by your body, it can actually cause insomnia later on in the night. And so for that reason, it's recommended that alcohol be avoided too close, like at least 2 hours before your bedtime. And also for persons who suffer from indigestion or acid reflux, it's recommended that you avoid fatty or spicy foods and large meals prior to bed. Next slide. The future. So several car manufacturers, including Audi, Mercedes, and Volvo, currently offer drowsiness detection systems that monitor a vehicle's movements, such as steering wheel angle, lane deviation, time-driven, and road conditions. When drowsiness is detected by these cars, the drivers are warned by a beeping sound and the appearance of a coffee cup on the dashboard. Next slide. Newer developments include car seats with sensors to monitor heart rate and breathing patterns that are in keeping with sleep. Facial recognition software, they're also working on that would monitor your expression and your blink rate to determine if you're sleepy. When you're falling asleep, you actually tend to blink a lot slowly, and that's one of the things that they can use to determine if you're about to fall asleep. Next slide. So interestingly, melatonin, which is like an over-the-counter drug that you can use to help yourself sleep, has been shown to decrease blood pressure in animal models, women and men, and it can also improve the quality of sleep. And so research is being done to see if it can be used as an antihypertensive medication in the future. And as we discussed at length, the sympathetic system is really in overdrive when you're sleep deprived. And it is thought that these medications should be used in patients who have hypertension, as well as sleep deprivation and impaired glucose tolerance, because this would help to prevent the development of full onset, full diabetes, as well as it can help with their sleep and high blood pressure. Next slide. These are my references. Thank you very much. Okay, hello everybody. So it's me again. I hope that you enjoyed that presentation. Do you have any questions at this time? I will be happy to answer any questions. So the blue light filter may help because the blue light is the one with the shortest wavelength that stimulates those photoreceptors in the retina the most. But the fact of the matter is that any sort of light can have that negative effect on the melatonin release and can cause sleep deprivation. So it's recommended that you just avoid using your cell phone at least not 1 hour before bedtime, because all of these things that we mentioned, they're not like a foolproof way to prevent it. So blue light filter to light can still cause a sleep deprivation. Yes,
I
that's me.
wish I had listened to your presentation before I decided against the blue light filter on my glasses, but it would. I know we have all learned more about the impacts of technology and how it affects our sleep and how our pharmacists can better assist their patients in that area. So on behalf of Apotex and all of us here, we just like to thank you for sharing your knowledge with us. And we wish you were here to accept our token. But I guess when you take your next trip to Jamaica, you can stop by.
Well, thank you so much for having me. It was truly an amazing experience. And I will be in Jamaica in 2 weeks, so I'll take you up on that.
Okay.